Hi, my name's Anna Marie Pergrello. I'm going to be talking about my rotations. And I'm outside because I felt like I needed some fresh air from being in quarantine. But that rotation week, I did PACU and day surgery. It's been a while. And I did admitting as well, both in which rotations I really enjoyed. So enjoy this video. And now I'm back downstairs and lonely again. So, I'm going to talk about my first rotation, which was PACU and day surgery. And the purpose of this department is primarily to get a full workup, medical history, allergies, and vitals of a patient before they go into surgery. This is just so that they could best prepare for surgery, medications they give you during surgery, maybe approach the surgery in an alternative way based on someone's medical history. So first the patient would come in and the receptionist would direct them to where they need to go. And then a nurse would enter the room and basically get the full medical history, ask multiple health questions, and after that the PA would come in and get the vitals of the patient. And that's pretty much how the process goes in that department. They interact with the surgical floor as they're responsible for gathering information before a patient enters surgery. They also interact with the laboratory. Sometimes they need to get some of the lab information in order to gather the documentation. They also interact with radiology as the scans are sent over for the paperwork that the nurses gather together. So that's a lot of the different departments they interact with. I would also say they interact with engineering, just because the engineering department would be responsible for the lighting and plumbing and basically all that kind of stuff in the department so that the department is powered. All right, next we're getting into the observations. I have a lot of observations for this department. I understood a lot of what was going on. And sometimes in rotations, to be honest, it is a little bit hard to understand what the doctors are talking about. But the nurse really paid very close attention to me and made sure I really understood what was going on and described patients before I entered the room. So we're going to start with patient 1. Patient 1 was a 5-year-old. He was really, really cute. He was drawing with his mom. One of my favorite patients throughout my whole rotation experience. But he was getting his tonsils removed in order to do a dental procedure. He had cavities on his baby teeth and he needed fillings, and the dentist could not do that without his tonsils removed because his tonsils were so enlarged. So basically the nurse just started by getting his full medical history, asking about any allergies, past surgeries, past injuries, medical providers, appointments, basically anything that they knew about his medical history. He did not have that much of a medical history considering he was so young and had not been in many accidents or had very many issues at all. So he just had an ear infection in the past, pneumonia, Lyme disease, very brief medical history. And the nurse would gather this and put this straight into a computer system and basically add it to his file. So that pretty much sums up that patient. He was a very nice boy, and he was going to Ellis McClellan in order to get his surgery instead of Ellis Knott, but since the hospitals are connected, this is their location for getting the full workups, and then based on which Ellis Center the patient is getting their surgery on is where they would go. And then I went back to the room and we saw the next patient. Okay, so patient 2 had a lot of issues. I'm just going to show you some of the issues that she had. right. Patient 2. She had some issues with her knee. She had some issues with her shoulder, both in which seemed very painful. However, her surgery was focused on her shoulder, and the surgery was potentially a humerus repair or a total shoulder replacement. And this happened to the patient as she was walking to her car. She didn't feel a rock and slipped over it and fell on the pavement. And as an elderly patient, that does a lot to your joints, and they're very prone to injury. And she has a medical history of diabetes, and the nurse suspected that her diabetes can cause numbness in her feet, maybe causing her to not feel the uneven surface or the rock, which could have potentially caused her fall. She had a very large medical history of many medical issues. I'm going to get into that right now. All right, beginning, she had COPD, atrial fibrillation, vascular stents, as I said earlier, diabetes. She was on a lot of medication to regulate these issues. She had multiple surgeries in the past. A lot of this they had to gather from her primary care physician, as she didn't want her patient to forget or possibly not give her the full medical history, so they had to have documentation. So one of the ways the nurse approached this situation and making sure she gets a full medical history and doesn't forget anything is she approaches the body systems and begins asking about the patient's heart health, stomach health, bladder health, kidney health, gyno health, which is the reproductive system, eye health, oral health, ear health, and just a lot of the different body systems. And that's to make sure she doesn't miss anything when asking. They asked about her medication use, her home life, if she would accept a blood transfusion, because some religions would not, and she may need one during surgery. Very rare, but the blood transfusion would be life-saving in case of internal bleeding. They checked her vaccination history, her travel history, and her mental health as well. So, going through her medications, we realized she was on a lot. She had a paper saying all the medications she was currently taking. That's just so she didn't lose track. She said she had a pill container in order to make sure she didn't miss anything. However, approaching surgery, she can't take all of those medications as they may interact with the anesthesia or just be pointless in general. So the nurse told her which medications she should and shouldn't take and made a list for her of what times to take certain medicines and when to stop. In addition, she went over care that the patient should do before surgery, and she should use a sterilizing lotion. A lot of the patients use when going in the shower, more like a sterilizing wash instead of lotion. And it just kills a lot of the bacteria on your skin, and this is another preventative measure in order to ensure that patients don't get infections or prevent infections. So yeah, she just went over a lot of the history of the patient. The patient did appear to be in pain, as she said her knee pain was an 8, and her shoulder pain was actually less, but her shoulder did need the repair. She had been in a wheelchair for a few days now and is going to go into surgery tomorrow, so I hope she did well. Now that I have my doctor mask on, I can describe the next procedure, which was an appendectomy and a hernia repair. So basically, I'm going to flip this camera around. The appendix is that thing at the bottom of the large intestine, and sometimes it gathers bacteria or gets inflamed for who knows what reason, and it bursts and causes many issues. Now, a hernia, let me just get a picture of that. All right, hernia. We have a lot of interesting pictures of that. So, here's some of the ones that pulled up. I'm just going to explain this. So, it's basically a bulge in the intestine, and it's caused by sort of the tissue loosening, and It causes great pain. It goes through the muscles. Sometimes it even goes through the skin and like stretches out the skin like that. And you could see hernias on the surface. So this patient had a hernia and had to get that repaired. They'll usually do that by clipping the hernia. Let's see. That's a good diagram too. Kind of see how it goes through the abdominal wall here. And it causes the patient great pain and really needs to be repaired. They'll oftentimes clip hernias and just kind of reroute the whole system there. Coming from a doctor, trust my word. Right, I'm done playing doctor. I really miss my doctor self. All right, now let's get more to this case. So basically, the nurse did a workup on this patient, as she did with the other patients. They made sure the patient really understood this procedure, kind of how like I just explained the procedure in my own layman way. The nurse did a much more technical overview of the surgery and asked the patient their name, date of birth, just verified that they knew what surgery they were getting. This is just so that the patient has full consent. So they asked the patient if they had pain or fever, and this oftentimes comes when someone's appendix bursts. The patient did have pain and had a fever a few days before. She asked about a health proxy and past records and my phone died, but I was getting at health proxy. Right, so health proxy will basically decide what happens to you as a person in case you cannot make your own medical decisions. In this case, it was the man's wife. So in case something happens to him where he can't decide basically what to do medically, the health proxy would make decisions for him. Basically, what kind of life-sustaining measures that he should have or what kind of medicines he should take. Basically, all medical decisions. Okay, now after asking about a proxy, they continued with medical information. So they asked about medication from pharmacies, and they get this documentation from pharmacies too in case the patient is not fully aware or maybe forgets about a medication. So they just ensure with the pharmacy as well as their general physician. So when they go through preparation for the surgery, the nurse goes through which medications they should stop and when they should stop them. And this patient in particular was on blood thinners. You don't want to be on blood thinners before surgery. That's very, very bad because the patient could potentially bleed out. So even though he was on blood thinners, he was told to stop those. That's really all for the PACU and day surgery department that I observed. The interaction between the department was very good. The nurses got along very well. You could tell they definitely had a strong relationship with each other, and they were very friendly to me, and I really overall enjoyed that. We are now entering the future of medicine in this department. Okay, that filter was really cool. But basically, some of the advancements within this department include the organization of the department as a whole and how they interact with other departments. So Ellis is doing something different where they're going to move all of their surgery to Knott Street instead of having a center at McClellan Street as well. And this is just going to keep the whole system more organized, and patients will be required to go to PACU day surgery department prior to going to surgery, and it'll just be much more organized. They're going to move the location of a lot of the departments. So yeah, it's just going to be a more organized system. In addition, computer systems are very portable and keep patient documentation all together, and they're constantly updating their computer systems, and the nurses will carry around portable computer thing that is very, very cool is that nurses are actually using their phones for some things, like to page each other in order to make, say like they need help in a different room, they can page each other and their nurse will be right there, or the PA will be right there, and they could also use it to look up information on different medication. And they have some apps for that too that's meant for medical professionals. Very cool stuff. All right, I'm going to talk about some of the education required to work within this department, day surgery, PACU. Some of the jobs are registered nurses, physician's assistants, and receptionists. Those were primarily the medical professionals I saw while I was shadowing this department. This is actually my second time trying to explain it because while I was this close to being done last time, my friend Annika decided to FaceTime me. Really convenient. But beginning, besides the point. So, registered nurses are required to take multiple steps, beginning with a bachelor's degree in nursing. And after they obtain their bachelor's degree, they must pass a national examination, which tests their general knowledge of nursing and nursing concepts. There are also required continuing education credits. So the amount of continuing education credits that they are required depends on whether they are a full-time or part-time employee, the number of hours they work, so it really fluctuates. And obtaining these credits, they can either get them from online courses or they can sit in on lectures such as medical grand rounds where medical professionals share their research and experiences with other medical professionals. And those are just some of the ways they can obtain these credits. All right, moving on. So receptionists are typically required a GED or a high school diploma, something equivalent to a high school diploma. And after receiving their high school diploma, they can receive on-the-job training. Primarily, it doesn't require a degree. However, someone can have an associate's degree in office administration, medical administration, or a related field, which can better prepare them to work as a receptionist. A lot of the job has to do with processing software and spreadsheets and office applications, and associate's degrees on those paths are available. Lastly, I'm going to talk about a physician's assistant. A physician's assistant will need a master's degree with postgraduate education after having completed a 4-year degree. And during a 2-year cycle, a physician's assistant is required to have 100 continuing education credits, which can be obtained from online courses or from medical grand rounds, where medical professionals will talk about the research and experiences. Next in this rotation reflection, I'm going to talk about some of the economics and government associated with some of the jobs in this department. So there are approximately 1,101,500 receptionists in the United States. That's a pretty big number. This is expected to increase by 59,300 jobs over the next 10 years. This is an approximate 5% increase in the job outlook, which is around average for a typical American job. Receptionists make a median salary of $29,140 per year. Moving on to registered nurses. Their average salary can run between $52,000 and $88,500. That's about average. And within the next 10 years, the job outlook is expected to increase by 9%, meaning that there will be a greater demand for nurses in the future. All right, I'm going to talk about physician's assistants. So a physician's assistant makes approximately $108,610 a year, and there are currently around 118,800 people employed within this field, and this is projected to increase by 31% over the next 10 years, which is much faster than average. And now I'm going to talk a little bit about jobs that are available within the public sector for physician's assistants, nurses, and receptionists. So I'm going to begin by talking about Planned Parenthood. Within Planned Parenthood, there are jobs available for physician's assistants and nurses, and this is a government organization. In addition, there are jobs available in the military for nurses, as well as in a jail setting. There are jobs available for nurses and physician assistants. All right, Now I'm moving on to the connections part of my rotation reflection. And what that consists of is a text connection, which is basically how I can relate it to a movie, a TV show, a book, or something else I have read. And I have to relate it to the world. Here's my equator. Here are my continents. So, how is this department related to the world and its people? And how is it benefiting the world? Okay? And lastly, I have to relate it to me. Have I had any personal experience with the things that this department are doing? Another piece we had to do for the connections part of our rotation reflection would be reading an article. Now, the article I chose is called Preoperative and Preparation for Anesthesia and Surgery. And it basically talks about the importance of getting a medical history of medications prior to surgery, just because anesthesia is such a strong medicine and can interact with other medicines. It's important to evaluate the medicines a patient is on in order to tell them to stop taking something at a certain time to avoid complications due to the anesthetic. All right, for this next connection piece, I'm going to show you guys some cool pictures, all right, or a cool picture. All right, do you see that person there? That's me. You see that person there? That's me again. Oh, that's me again. I'm crying in that picture. Oh, and there's me again. And that's basically going to lead us into the next part, which is talking about how this rotation relates to me. So, long back ago, I got hit in the face with a soccer ball in my retina tore. And it didn't really hurt, but I saw a flash of light. Kind of weird. Needed to get it repaired. And in order to do so, they had to get a full workup of my medical history. Kind of like the nurses did in this unit. Very similar experience. I'm going to talk about how this rotation relates to the world. Isn't that pretty cool? It's like 3D. The world is a pretty cool thing. You see, if we didn't get workups with people prior to surgery, the death toll caused by surgery would exponentially increase. It is important that we understand a patient's medical history before surgery so that a surgery can be very planned, because there's a lot of components going into surgery: the doctors, the nurses, the history, the medication, and we've worked our way in order to be able to do certain surgeries with research and everything. So learning about how a patient themselves affects how they can handle surgery really is a very important aspect of surgery itself.
I can relate.
Oh, forgot I was doing this rotation video. I was just busy watching Grey's Anatomy. Oh wait, that's my text connection. So, though it may seem lame, I'm relating this to Grey's Anatomy because they would take medical history before a patient went into selective surgery. And in any case, if they cannot take medical history before a patient enters surgery, they will give a blood type that can be donated to any donor, such as type O, in case the patient needs blood, and it is a little more risky with anesthesia and other things, but it's all circumstantial, so hopefully it was selected surgery. Alright guys, it's evaluation time. So overall, I learned from this experience all the steps leading up to surgery, and that surgery is really only a minor aspect. The diagnosis, the screening, the preparing for surgery, just a lot of aspects all go into surgery, and this is one of the preparing departments that not a lot of people realize has such a big role. And some of the hours within this department are, well, most of the people in this department are nurses. It's primarily a nurse-run department. There are physician's assistants and a receptionist, and typically, since this is gaining vitals and general workups and gathering information before surgery, typically there are more flexible hours. There aren't night shifts in this department. People will come in with a scheduled appointment, so it's not very random. All right. Personally, I wouldn't pursue a career in this field just because I'm more interested in the surgical side of things rather than documentation and medical history. I'm more interested in anatomy, which is why I was a little more interested in surgery and the laboratory and things more to do with biology. However, it did help me to broaden my knowledge on all the pieces that really make a hospital run and just really make things possible, make certain treatments possible. A lot of people don't realize the roles of all the department in the hospital, and that this is really just as important to surgery as the surgery itself. I really enjoyed my rotation. I learned a lot. The nurses were very kind to me. It was overall a very pleasant work environment, and everyone was friendly to each other as well as me. Next, I'm going to talk about my experience shadowing the admitting department. So on my third day of rotation, I got the opportunity to shadow the admitting department, which is basically in charge of looking up your medical records, and there's a medical record number, and they look up your insurance, and there's a number for that too that just verifies exactly which person's insurance and medical record they have. They also look up your social security, and they deal with finances in general. The department is made up of insurance verifiers, Medicaid facilitators, and a senior director. They also document when people pass away. They hold all the medical records and are in charge of transfers from other hospitals outside of the Ellis domain. So if someone had medical records from their general physician or from Albany, from St. Peter's Hospital, they would be in charge of getting the medical records from over there. So before patients go into surgery or into radiology or into a certain department in order for screening, they will first go to admitting, and admitting will direct them to where they need to go. So that being said, they interact with the surgical floor, radiology, nursing units such as adults and peds, and just many different departments throughout the hospital. Beginning my rotation, I viewed one of the admitting receptionists, and it was actually neat to find out that we are related through marriage. It was really cool. We had a long discussion about our family, but besides the point, she taught me what they're in charge of. She basically went through how they program someone's medical record, insurance number, social security, and how they keep all the patient's documents on file and can look up certain tests, where they were taken, and that really helps them direct the patient to where they need to go. Currently, I'm in the car on the way to Oneonta. There's my sister. We're picking up her things because of COVID-19. So I'm going to talk next about some of the patients I saw while I was at admitting. So the receptionist did direct a patient to the Brueggemann Center in order to get an endoscopy, colonoscopy. In addition, a lot of the patients were coming in for blood tests, so she would direct them to the waiting area to get their blood tests, and she would give them the forms that they needed to fill out. She also helped this couple that had broken English and couldn't really understand. She helped translate for them as well as get their documentation and figure out where they needed to go, which was the hematology department because they needed to get blood tests. In addition, a patient came in who was getting surgery at St. Peter's, however, had to be redirected to this hospital, so she was in charge of getting a lot of the paperwork over from Albany Med to the Ellis domain because they are separate. There are separate programs. In addition, we helped patients with pre-surgical screening, so patients who needed to go to radiology or get MRIs. She would direct them to where they needed to go and give them the paperwork that they needed to fill out prior to that. And yeah, that was my experience with the patients coming into admitting. Advancements within admitting primarily consist of advancements in computer systems and computer programs. So the domain of Ellis, all their clinics and separate locations share the same computer system, so they can look up a patient by their ID number and have all the documents. And if they needed documents from an outside domain such as St. Peter's or their at-home pediatrician, they could contact them and get the documents on their domain. And this just saves a lot of time, and these computer systems are constantly updating. So I'm going to talk about some of the education needed to hold a job within this department. I'm going to start with insurance verifiers. So insurance verifiers are required a high school diploma or an equivalent of a GED, and they also receive on-the-job training. A Medicaid facilitator requires training and certification after having completed a course, in addition to having a high school diploma or an equivalent of a GED. And they don't have continuing education credits, however, they do require recertification if they're out of the job for an extended period of time. Another job within the department is a senior director, and they will require a bachelor's degree in management or a related field. And they require about 30 continuing education credits every 2 years, and these can be acquired from online courses. Now that I'm home from Oneonta, I just took a nap. I'm well rested. I'm going to talk about some of the economics and government associated with the jobs I previously discussed. So a Medicaid facilitator makes around $47,000 a year, which is around $23 an hour. And the job outlook for the next 10 years is expected to increase by 7%, which is a 1,400 employment change approximately, and this is faster than average. A senior director makes around $65,000 a year, which is around $31 an hour. The job outlook is expected to increase by 13% over the next 10 years, which is around a 22,000 employment change, and this is faster than average. Insurance verifiers make around $29,000 a year, which is around $14 an hour. And the job outlook is expected to increase by 5%, which is around 59,000 workers, and this is as fast as average. All right, I'm going to talk about some of the jobs available in the public sector. So a lot of these jobs, such as a Medicaid facilitator, a senior director, and an insurance verifier, are all available in a Planned Parenthood organization, which is a government-run organization. A senior director is a general management position, so someone with a degree to become a senior director can work within a school setting or government-run companies, such as a security company, police force, a prison setting, or in Planned Parenthood as well. So there are many different options for a senior director, as it's not only focused on healthcare. I'm now going to talk about some of the connections I had for the admitting department. So I can relate this department to me because when I'm visiting family, the admitting department will direct me to where I need to go. For example, when I was visiting my grandma, I had trouble finding her in the C wing, but I went to admitting first and they directed me to where I needed to go. I connected this to the world because they contain death certificates and medical records, and it helps them to better plan medical treatment for the future by documenting their medical history. And in different areas of the world, they have a little bit of a different way of doing this. Earlier in the year, we watched a documentary, and people had medical cards that contained all their medical information. And for Ellis's domain, this is very similar. Admitting will keep all the information for them instead of having those cards that have all the medical information on them. So for text reference, I related this to a TV show. I related it to Untold Stories for the ER because there had been a case where they couldn't identify the patient and they did not know their medical history. and they gave them a medication that they were allergic to, and they had a very bad reaction. But the admitting department keeping all the paperwork can help to avoid situations like this. Right, so for the article I picked an article called How to Significantly Reduce Inpatient Admission Times and Improve Satisfaction. And it basically shows how the admitting center deals with paperwork and how it's more efficient than having paperwork separately, and how it improves quality of patient care as well as the time spent at the hospital. It's more time efficient. Throughout my rotation at admitting, I overall realized the importance of having paperwork and understanding someone's medical history as a whole, from all different locations they can send it to admitting, and it's important to have their whole documentation. And this helped me to grow as an individual because I realized all the extent of the paperwork that is associated with medicine. And overall, I enjoyed my rotation because I did have something to relate to with the person I was shadowing, because she was married to someone in my family, so we're related through marriage very distantly. It was very cool. We talked about the family a little bit. But typically shifts there are about 8 hours, and they do work some night shifts as the hospital is open all the time and as admitting is always needed. But overall, I wouldn't consider a job in admitting because I'm more interested in the biological aspect of medicine rather than the paperwork aspect.